Hi everyone, and welcome to today's video titled How the Golden State Stays Shining, California's Efforts to Help Its People, presented by me, Con. My brand is Golden Girl and my motto is Live Golden, Shine Bright. Here at Golden Girl, we focus on ways to promote wellness, success, and happiness. Today's topic focuses on Covered California, including what it is, who qualifies for it, ways to enroll, and its impact on healthcare costs and care. Firstly, what is Covered California? Covered California is California's all-in-one health insurance marketplace. It was created in compliance with the Patient Protection and Affordable Care Act, also known as the ACA, enacted in 2010 under President Barack Obama. The ACA requires that each of the states either have their own state-run health insurance exchange or offer enrollment through a federally operated exchange, since it was legally mandated that all American citizens need to have qualified medical and health insurance. Covered California features a partnership between the California Health Benefit Exchange and California Department of Healthcare Services, working to offer lower, if not free, insurance for individuals, families, and small businesses. A free health insurance offered by Covered California is California's version of the federal Medicaid program, also known as Medi-Cal. Covered California is convenient for many reasons. It is a free service that allows people to compare health insurance plans from various private companies. It also helps people determine if they qualify for financial help based on their income and other factors. Lastly, people can apply and enroll for these insurance programs all from Covered California's platform. Every insurance plan offered by Covered California includes the 10 essential health benefits mandated by the ACA. These 10 include ambulatory patient services or outpatient, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder or behavioral health, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management and pediatric services. Covered California also ensures that health insurance is available for all, regardless of their income and previous or current health history. Covered California offers three types of insurance plans. The first is a health maintenance organization, also known as an HMO. This typically consists of a smaller network where referrals to a specialist are often made by one's primary care physician. A preferred provider organization, or a PPO, is a larger network that allows for specialist consultations without referrals by a primary care physician. These are typically more expensive than an HMO. A combination of these two plans is seen in the third option, also known as the Exclusive Provider Organization, or an EPO. These consist of a smaller network like HMOs, but provide more freedom with specialists like PPOs. More information regarding Covered California can be found on their website at www.coveredca.com. Who typically qualifies for Covered California? Any California resident or American citizen or national that 1. Works for themselves, 2. Is low, middle, or high income, 3. Is an immigrant with eligible status, 4. Whose job doesn't offer health insurance, or 5. Is in between jobs typically qualifies for Covered California. How do you enroll in Covered California? To enroll in Covered California, there are 4 easy options. One can complete the online application on apply.coveredca.com. This takes around 30 minutes to complete. This is typically the most convenient option since it allows for progress saving. Another option is to go in person and complete it with a certified enroller. This takes around 60 minutes, but is typically easier for those who prefer hands-on help. A third option is to apply by phone. You can reach them at the number 800-300-1506 from between 8 a.m. and 8 p.m. Monday through Friday. They can also be reached on Saturday from 8 a.m. to 6 p.m. A fourth option is to fill out a paper application and mail it to the appropriate address. When can you apply for Covered California, and what other information might you need in applying? Open enrollment begins November 1st, 2025 and ends January 31st, 2026. However, there are some exceptions as to applying outside of the designated open enrollment. If you have a qualifying life event such as an involuntary loss of coverage, relocation, change in marital status, or a birth of a child, an application needs to be submitted within 60 days of the event date. If you are a federally recognized American Indian tribe or Alaskan Native, you can apply up to once a month. If you are eligible for Medi-Cal, you are able to apply year-round. Applicants need to provide their Social Security number if they are a U.S. citizen, or documentation information if an immigrant. They also need to provide employer income information for everyone in the household. Federal tax information for the head of the household and for any dependents must also be included. Lastly, any current health insurance that anyone in the household might have through a job must also be noted. To pay for pharmaceuticals and medication, there are typically 4 tiers of coverage to choose from. The lowest tier, the bronze, measures your health plan paying for 60% of your medical expenses while you pay for the rest of the 40%. This plan best suits anyone without any medical conditions. This plan features a fixed copay of $60 to $95 for the first 3 office visits. The medical deductible for 2026 is $5,800 and the pharmacy deductible is $450. The annual out-of-pocket maximum is $10,600. The silver tier, or 70/30, is the most popular plan, which serves any person who wants access to common services. Common services include a visit to the doctors, lab work, generic drugs, and emergencies. These all have a set copay. Generic drugs typically cost around $19. The medical deductible for 2026 is $5,200, and the pharmacy deductible $50. The annual out-of-pocket maximum is $9,800. The gold tier, or 80/20, is best for a healthy individual who uses medical services frequently. Doctor visits range from anywhere between $35 to $65, and generic drugs typically cost around $15. There is no medical or pharmacy deductible for this tier. The annual out-of-pocket maximum is $9,200. The highest tier is referred to as the platinum tier, which is resembled as a 90-10 relationship. This is the least popular and most expensive coverage, best suited for an individual seeking frequent medical services, hoping for the least amount of out-of-pocket expenses. Copays for all medical services are applied. Doctor visits typically cost around $15, while prescription drugs cost around $30. There is no medical or pharmacy deductible for this tier also. The annual out-of-pocket maximum is $5,000. One additional coverage plan not listed within the 4 tiers includes the minimum coverage or catastrophic plan, which offers a low monthly premium. This best fits for anyone 30 years and younger who don't typically qualify for premium assistance and are most concerned with affordability. The first 3 office visits are free, but this plan includes the highest deductible and out-of-pocket maximum. All of the mentioned coverage plans offer free preventative care. This chart is a more comprehensive graphic for the upcoming 2026 coverage plans and medical costs. Covered California includes 11 health insurance companies offering coverage across the state. Listed on the slide are Molina Healthcare, Inland Empire Health Plan, Anthem Blue Cross, Valley Health Plan, Western Health, Sharp Health Plan, Balanced by CCHP, LA Care Health Plan, HealthNet, and Kaiser Permanente. What is the impact on access and quality of care? In terms of accessibility, Covered California increases availability to health insurance, especially for marginalized groups. In 2013, the rate of uninsured Californians was 17.2%. 10 years later, in 2023, the rate of uninsured Californians is 7.4%. Another reason why so many people are able to afford and access health insurance is because Covered California offers lower monthly premiums because of the competitive marketplace it fosters. Quality of care significantly improves because members of Covered California have access to higher quality private insurance. It provides people with the option and ability to receive any of the 10 listed essential health benefits mandated under the ACA, which can improve many aspects of one's life or even open doors for types of care one has never received before. Additionally, it works to counter current health disparities existing among marginalized groups by providing care regardless of racial, ethnic, socioeconomic, and geographical status. The graphic on the top illustrates the prevalence of Covered California users among different regions of the state. We can see it's most popular in Southern California and the Greater Bay Area, which sees much urban development. The bottom graphic illustrates Covered California in 2023, including that 1.7 million Californians were enrolled, and 93% of them could choose from three or more carriers. It's important to note the diversity and ability to choose from various carriers because it's always better to have more options and choices in improving one's health. This next chart examines current enrollment numbers, finding nearly 1.98 million Covered California enrollees as of 2025. The data for new enrollment also shows a steady increase every year, showing Covered California's consistent rise in enrollment. One possible worry for the future is that there will be higher premiums starting 2026. The current enhanced premium tax credit that keep these premiums affordable will expire by the end of 2025 because they weren't extended in President Trump's One Big Beautiful Bill Act of, or also known as HR 1. Premiums can increase by nearly 90%, 97%, with highest impacts among those low income, older, self-employed, and/or communities of color. But overall, Covered California is a great option for anyone looking for affordable health insurance. And yeah, thank you for watching this video and stay tuned for more content from Golden Girl. Thank you.